Good morning, everyone. So today we have reached the part 4, the last part of the goniometry module. In the previous modules, we have learned about the basic definitions of range of motion, active and passive range of motion, what is hypermobility, what is hypomobility, the concept of kinematics, osteokinematics, arthrokinematics, the concepts of the degree system of goniometer, what is goniometry. Then we have spoken about the principles of goniometry. Later we learned about the techniques and steps involved in assessing the range of motion using goniometer. So we have finished all the crucial part of goniometry. Now we'll start with the uh, last part of goniometer. So now we have understood about the techniques and principles of goniometer. Here comes the most important step of recording. So now when you know that how to do this technique, what is a landmark, where to place the arms of the goniometer, where to place the fulcrum of the goniometer, you need to record whatever you're doing on the patient. So you need to document whatever you have done on the patient. So in recording or documentation, you need to write down the name, the age, the gender of the patient, preferably IP/OP number of the patient which will be available in hospital, the date and time of assessment. Then you need to mention what type of goniometer have you used. If you remember, we have spoken about various types of goniometers. So basically, in clinical setup or right now we are using universal goniometer, but if you wish to use something like bubble goniometer, you need to mention what type of goniometer you are going to use on the patient or you have used on the patient. Then definitely which side of the body or which side of the joint have you assessed, whether it is right side or left side, you have to mention very clearly about the sides of the measurement. Which range of motion have you taken, which means whether it is flexion, whether it is extension, abduction, adduction, external rotation or internal rotation, you have to mention which range of motion. So basically you have to write down flexion is so and so, extension is so much, abduction is so much, and so on. So you will have to mention which range of motion you have taken. Then of course you have to mention whether it is active range of motion or passive range of motion. This is very important. You need to write down whether it is AROM or PROM. Then you have to mention if at all you have used some other position to assess a particular range of motion, which is different what has been universally followed. If something else you have used during your goniometry session for any reason, you have to mention the entire positioning, the entire description of the change position of the technique. So please mention if you have used some other technique of goniometry. Now, the accuracy and reliability of goniometer, whether your readings are accurate enough, whether your readings are reliable enough. We have spoken about what is reliability in the previous modules. So basically the readings, your accuracy and reliability depends on various factors. Whether your reading is right or whether it is incorrect, it depends on various factors. Factors like positioning of the arms and axis of goniometer. There is a standard way of positioning arms and axis of goniometer, and if you deviate from that standard method, your readings will be changed, your readings will be altered. So your recording or your reading won't be accurate or reliable anymore. So you have to make sure that the positioning of the arms and the axis of goniometer should be placed as per whatever has been universally followed, whatever has been given universally in the books. point is the axis should be placed on the axis of the joint only where the motion takes place. This is also we have spoken in the previous module that axis of the fulcrum should be placed on a particular landmark where there is maximum range of motion takes place. So you cannot deviate your axis also as per your choice. Otherwise, the result will be wrong. So sometimes axis coincides with the bony landmark, but sometimes it does not. So that we will learn when we are learning about various methods of range of motion in all the joints. But as of now, you should remember that your accuracy and reliability of readings depends on how you have positioned the arms of the goniometer and how you have positioned the axis of the goniometer. So in this figure, you can see that the therapist is looking and palpating for the bony landmark where the motion takes place of a particular joint. So this is shoulder joint. So the therapist is palpating for the bony landmark, and you can see that he is trying to mark the particular landmark, because if you mark it, you are sure about that this is the landmark and I have to place my axis of the goniometer at this landmark only. So you will not deviate and your readings will be much better. It will be much accurate and reliable. So it is important that you expose the area and you palpate the landmark, the bony landmark, and also mark it with a marker or a pen after taking consent from the patient. You need to take the patient's consent or permission before doing any of the above procedures. So once you have marked the landmark with a pen or a marker, you can be very sure that this is the axis and I can place my goniometer axis right at that mark point. So all these factors are very important so that your readings are not wrong and it is very much accurate and reliable. Now other factors which can actually affect the accuracy and reliability of your range of motion can be fear of pain. If the patient is scared of the pain which he is having, he will not do the range of motion or the movement quite well. So if there is a lot of fear in the patient, your readings won't be accurate. Second factor can be fatigue. If you are trying a lot many times on patient the same range of motion again and again just to check that you are right, or maybe you are practicing on patient, probably the patient can get tired. If he gets tired, obviously the range of motion won't be accurate anymore because the muscles are tired. Or if the patient, you have made patient do a lot of exercises and immediately after exercises you want to take range of motion without giving break to the patient, again it will lead to fatigue and your range of motion won't be accurate and reliable. So you make sure that you have given ample of time for the patient to relax and recover before you take range of motion. The patient should not be fatigued. Okay. Next point is type of goniometer. So if you're using various types of different goniometers like bubble or universal, so your readings may vary. So depending upon the type of goniometer also, your accuracy and reliability changes. Then you have tester, which is us, which is a physiotherapist. If the tester is novice, if the tester is not much trained, the recordings may change. So again, I'm telling this is a practical technique. You need to practice not many times before you actually do on a patient, because if you are not trained enough, the accuracy and reliability of the results will be poor. So if the tester is trained enough, the readings will be much accurate and reliable. So these are the factors on which the accuracy and reliability of your readings can change or it can depend on. Now coming to interpreting the results. So how do we understand these results? I have spoken about this also in the previous module, that even if the patient says I have problem on the right side, you need to take the range of motion on both the sides. You need to take the range of motion on the unaffected side also, because you need to compare the two readings. If you don't do that, you don't know what is normal for that particular patient. Yes, there are normative values available. For example, 180 degree of abduction, 180 degree of flexion. But every patient is different. Sometimes some patients have normal only 160 or 170 degrees of range of motion. If that is normal for the patient, then the normative data changes. So you need to compare with the normal side of the patient. So if I have problem at right side, you need to first check my left side, all the range of motion, and then you come to my right side and then assess it. Finally, you compare both the results. So that is how we interpret the results. Now coming to the uses of goniometry. So whatever data you have obtained, whatever range of motion, whether it is active or passive range of motion, you have obtained from a patient, it will help us in determining and finding out the presence or absence of a particular dysfunction, particular impairment or particular problem. So when you have the data, you can understand that patient has some impairment or some dysfunction. So that will help us in kind of diagnosing a problem with the patient, an issue. This range of motion readings will also help us in developing the treatment goals. It will help you in chalking out the goals for the patient, how much you want to achieve in this patient, how much you want improvement in this patient. So you can formulate your goals after getting the data of the patient. Next is you can evaluate the progress. You can check whether your patient is improving or not. If you have the pre-recordings, pre-range of motion of the patient, after few sittings of physiotherapy, you can compare with the previous range of motion and the current range of motion of the patient, and that will help you in understanding whether you are moving in right direction or not, whether you are improving anything in the patient or not, whether you want to change the protocol, whether you want to increase the exercises or reduce the exercises. So basically it will help us in understanding the prognosis of the patient, whether he is improving or not improving, whether he needs any changes or he doesn't need any changes. So these readings will also tell you about the improvement or the prognosis of the patient. So depending on that, you can modify the treatment. If you are thinking that this is not working much on this patient, you would like to change the treatment, you can modify the treatment, you can add on certain exercises or certain modalities. So this range of motion data will help you in lot of many things, in finding out the dysfunction, in developing your treatment goals, in determining the prognosis and modifying the treatment. It also helps in motivating the subject. So patient can also see the pre and post readings. If pre is, for example, 110 degrees of shoulder abduction, and after your 3 settings of physiotherapy, it is 130 degrees of range of motion. So he gets motivated because he has seen improvement of approximately 20 degrees. So these readings also helps in motivating the patient. This is helpful in research purpose also. It also helps in formulating or fabricating new orthoses or adaptive equipments. So there are many uses of goniometry, and it's very important for a physiotherapist to know this. Now coming to precautions. So when you are doing goniometry, you should be aware that the joint, if it has inflammation, that means the patient will have pain, the patient may have swelling. So your range of motion can change if the patient has pain and swelling. It won't be very accurate. and it may cause pain to the patient also. So you need to be cautious. You need to be slow to that patient. Then if it is hypermobility, we have already understood the terminology hypermobility in the previous class. There can be excess of range of motion. So you need to be cautious in such patients if they have hypermobility. Osteoporosis is another factor where you should be cautious. You should be careful in dealing with osteoporotic bones to avoid any kind of injury or damage to the bones. Hemophilia, where it's a bleeding disorder. So basically, you should be careful that you are not supposed to cause any injury to the patient, because this is a bleeding disorder and the patient may not be very comfortable if he has hemophilia and your goniometry is not very careful and your instrument is very sharp. So you need to be careful in your technique in such patients. Then suspected ankylosis, where there is fusion and stiffness of the joints. In such cases, the therapist should be cautious. You are supposed to do goniometry definitely in all of these patients, but you need to maintain the precautions while doing your technique on goniometry. Now coming to contraindications where you should avoid goniometry. You should not do goniometry, you should not assess range of motion in certain conditions like joint dislocations. The joint is dislocated, you're not supposed to move it. You're not supposed to do passive or active range of motion because the joint is dislocated. You will cause much harm and pain to the patient, so you're not supposed to do it. This contraindication means you're not supposed to do it. Unhealed fracture. Any fracture requires immobilization to heal. So you should not move it. You should not move the fracture segment just because you want to take goniometry. So these are contraindications. If it's an unhealed fracture, do not move it. Do not do active or passive range of motion because it needs to be immobilized. Then immediate post-operative period. Soon as the patient has undergone a surgery, you should not do goniometry because of obvious reasons of pain and discomfort. Any pain and discomfort will lead to improper or incorrect readings, and you should not mobilize the sutured site. So these are the contraindications where you are not supposed to do goniometry. Now before we wind up this session, this module, you remember these steps very well. You should be remembering this now. You have understood the technique, the procedure, the principles. Now these are the crux of those modules. So when you are approaching to a patient, you need to introduce yourself first. You need to mention your name, you need to mention your designation, who are you, and explain the purpose of your testing. Explain why you want to do goniometry first of all, and demonstrate the range of motion on yourself first. Do not forget this is very important if you want cooperation with your patient. Next is to show the goniometer to the individual. You need to show the instrument that this is the instrument I'm going to use and this is what I'm going to do. This is the range of motion I want to take on you, and you have to make sure the patient does the same movement. Okay, so you need to explain the entire procedure, and before that you need to introduce yourself. Then you have to take consent from the patient for exposing that particular part, because you need to locate the landmark, you need to palpate for the landmark. So before that you need to explain why you need to palpate for the landmark, what are you looking for. You need to palpate because not all patients will be comfortable in exposing or removing of the clothes. So you need to explain why it is so necessary to expose the particular landmark, because you have to place the axis of the goniometer and your correct readings depends on patient's cooperation and the landmarks exposed. So that is why you have to explain this process to the patient very well. Explain and demonstrate why changes in position may be required. So For a particular joint, if it's shoulder also, you need to change position for abduction, adduction, uh, external rotation. So every time if you have to change position, patient will get maybe irritated. He will not cooperate with you anymore. So beforehand only, before you ask the patient to come into supine or then come to side lying or then come to sitting, don't do that. First, explain the entire procedure that you may require to change the patient position because so and so range of motion you have to take, and it is important to maintain the patient in a particular position only. If you deviate from that particular position, the range of motion will not be correct anymore. So beforehand only, when you meet the patient, you need to explain all these things verbally to the patient. So once he has understood, the patient will very well cooperate with you and you will end up having accurate and reliable recordings. So these are the points which you must remember. After this, you need to explain the patient the entire procedure. You should explain how you're going to do. You can probably take your one more model, your colleague, where you can demonstrate the procedure so that patient is comfortable. Patient understood the entire procedure. He'll not be panicky. He'll not be worried. He'll not be irritated. So once you have understood everything, you can definitely expect cooperation from the patient. So then you obtain confirmation of the individual understanding of your explanation. Then you need to find out whether the patient understood the entire procedure or not. So if you are sure, if you are thoroughly sure that patient has understood the entire procedure, whatever you have explained, and if he has any clarifications, please clear that also, so that in between when you are doing the procedure, patient is not hesitant, patient is cooperating well, so that your readings are good. So please understand that you have to build up a rapport with the patient. So you need to communicate with the patient very well. Without communication, you can't explain the patient all these steps, and then you can't expect cooperation if you are not explained him well enough beforehand. So understand all these important because we are in healthcare sector. So we need to communicate very well to the patient. Communication is key to everything. Always remember this. So I hope you have understood all the four modules of goniometry. If you have any doubts, you can definitely come and ask me. You can drop in the comment section also for any doubts and clarification. I hope the session was informative. Thank you so much. Thank you for listening. Thank you for your cooperation. We'll deal all the doubts in the practical session. Thanks a lot.